I haven't had anybody even look twice to imply that it is unnatural at all.
All this is constructed in this area there. And then, it transitions to the hairline, and you can see how seamless that is. These are all fine hairs. These fine hairs all came from the nape of the neck and around the ears, because that's where we have the fine hairs. And this is where transplants can get tricky, because if you use thick hairs here, then it really becomes harsh looking and pluggy, and it doesn't look natural. But here you can see it really looks very, very natural. We use the U-graft and the U-punch to extract hairs from this usually difficult to extract areas, around the ears and the nape. And we purposely put them right in front of the hairline and the temple points to give you this kind of result that you see right now here.
I was severely bald. The front and the temple points, the hairline were completely gone. You combine those two together, and that was sort of a frightening concept, because even though I'm fairly tall, that's unavoidable to look at. It's pretty exciting to be able to walk into a room and feel completely comfortable, instead of wondering if you'll run into somebody you hadn't seen for 10 years who will look at your head and try and ask how you got so old. So after my procedure, I developed a very small area of necrotic tissue. Dr.U diagnosed it immediately as a little area of necrotic tissue, which happens in all kinds of surgeries on occasion. And you immediately put me on several prescriptions that immediately started to cure the area, and it was completely healed fairly quickly. And then I came in, and without doing any shaving at all, you replanted grafts in that area, and you would never know that it occurred.
So what you had is scalp necrosis, not a very common thing in transplants. It's common in patients that have had prior procedures, like invasive procedures like scalp reduction or flaps. Also patients who smoke or have other vascular diseases, which you don't have. So that came as a surprise. But the good thing about it is that you reported the moment you noticed something was unusual there. And that's a good thing. We were able to intervene early by increasing the blood supply to the area, and aim at that point is just to shrink the area involved, and we shrank it to as little as we could get it. And then once it healed, we placed a few grafts there, and everything is now history.